Hi, my name is Russell Vinik. I'm the Medical Director for GBS Benefits, and today I'm going to be talking to you about preventative care and what you can do to make yourself healthier. So let's go through a few slides, and unfortunately, since this is a recording, I won't be able to answer questions, but we do have our preventative and wellness teams at GBS who are always available, and certainly I'm always available for questions offline. So first of all, what we're going to talk about is what is preventative care and talk a little bit about insurance coverage and then answer some of the more common questions about preventative care. So first of all, what is the definition? Preventative care is routine health care that includes screenings, checkups, patient counseling to prevent illness, disease, or other health problems. So this is what we do in medicine. Obviously, your doctors and providers are trained to treat disease, but more than that, what we want to do is to prevent diseases from happening. So what's included in preventative care? There's a lot more than just checking your cholesterol or checking your blood sugar. First of all is evidence-based screenings and counseling. So screening people for diseases like depression or risk for depression or diabetes or high cholesterol. Certain cancers, we all know about screening for cancers, depending on people's risk factors, screening for HIV and other sexually transmitted infections, and then counseling for many items, including obesity, drugs, tobacco use. In addition, immunizations is a very important and hallmark of preventative care, and certainly COVID-19 is one of those many immunizations that are important to get, and over the next few years, we'll know how frequently those need to be given. And then particularly for women who have spent more time on this and know probably more about this, we think about well woman visits, including mammograms. As far as children's, not just a child getting their immunizations, but screening them for development and behavioral assessments. There's a long, long list of recommended preventative care, and you can see I have that website below, healthcare.gov/coverage/preventative care benefits. So let's talk about insurance coverage, because a lot of people are worried about what they might be required to pay for as far as preventative care. So almost all plans are required to cover preventative services without co-insurance or co-payment. Typically, even high deductible plans, these are covered before your deductible because it's important, right? People are worried about spending their own money in prevention, but that ultimately saves a lot of bad outcomes and also ultimately saves the health plan money. So these are typically covered before your deductibles. You certainly would be best to check with your plan before doing anything, because not all plans are governed by the same regulations, but preventive care are normally covered with a few important considerations. One is it needs to be done by an in-network provider. Number two, a lot of times there's confusion about what is a preventative visit versus a treatment visit. For example, somebody goes for a general health evaluation, but also is being treated for high blood pressure. Well, if the primary focus of that visit was to evaluate and treat the high blood pressure, even though that's a preventative type of thing, that's typically not coded as a preventative visit, and then co-insurance and co-payments may apply. Another really common problem we see is some screenings which people expect to be preventative, for example, a colonoscopy. So normally, colonoscopies are recommended every 10 years in normal healthy people without significant risk factors. The new guidelines recommend these screenings begin at age 45. But certainly there's people who might have an abnormal finding on a colonoscopy or high risk condition that requires subsequent colonoscopies more frequently than every 10 years. And in those cases, those subsequent colonoscopies may not be considered preventative, and coinsurance and copayments may then apply, as it would not necessarily be considered preventive. Another common problem we see are procedures like mammograms, where if somebody has an abnormal mammogram, they may need a follow-up mammogram, or what's called a diagnostic mammogram. That first mammogram, which was the screening mammogram, would typically be covered under the preventative care benefit, but any subsequent additional studies that are required, or if someone's required to come back, for example, in 6 months, those are typically not considered preventive and would fall subsequently under the medical benefit where coinsurance and copayments apply. A few other frequent questions that's important to at least think about. One is, how should I approach these visits with my doctor? What I would recommend is, when you're sitting face to face with your doctor or provider, ask them, what do these metrics mean to me? Well, if my cholesterol is this, what does that mean to me? And what is the risk to me? And what is the benefit for various different treatments? And also, certainly different treatments, asking about what are the risks of these treatments. Any treatment we do in medicine, particularly medications, has risks, and it's so important just to have that frank discussion. What are the benefits I can expect by treating? What are the risks by treating? And then also a good question to ask is, what can I do to improve my health and decrease my risk of illness? Another frequent question that comes up is, how often do I need to have a preventative care visit? For women and children, the answer is pretty clear that annual is usually appropriate. Men, there's a bit more controversy about when is the most appropriate time. As a general rule, adult men, probably every other year, be from ages 19 to 39, and then likely annually for people 40 years or older, or men who have conditions or at risk of significant conditions, particularly people with hereditary risk factors for diseases like diabetes, high blood pressure, and cancers. A third really common question is, how do I find a provider? Particularly, how do I find a good provider? Well, a couple of strategies I would recommend. First of all, your health insurance company is required to post a list of all of the providers in their network. And so you can usually do this by going to their website. You can even request a directory. Most health insurance companies also designate providers that they consider to be high value providers. These are likely providers who provide good care at a good cost without overutilizing. A second option is looking at health systems. Most health systems are going to have a list of their providers. If you decide you want to get care at blank health system, you can go to their website. And a lot of health systems nowadays even post online reviews of their providers so that you can choose one that suits your needs, and certainly one that other patients have recommended. So to sum this up, preventive care involves screening for multiple conditions: high blood pressure, high cholesterol, diabetes, cancer, HIV, hepatitis, sexually transmitted infections, and lots of other conditions. Preventive care also involves counseling, addressing high-risk scenarios like depression, domestic violence, seatbelt use, guns, and how are those stored in the house, people's eating habits, people's exercise habits. And finally, vaccination is a very important part. Vaccines save lives. They've saved millions of lives every year, and it's important to make sure you discuss with your provider what vaccines should you be getting and what gaps might there be in your vaccination history. So, prevention is clearly better than cure. We in medicine focus on preventing disease. We're also there to treat it when it happens. But please, please take care of yourself and do what you can to keep yourself healthy. Again, my name is Russell Vinik. I'm the medical director for GBS Benefits. Thank you so much for joining me.